what is special, what I like to mention is when we started in 2018 or even in 2017 or earlier, the idea of blockchain is something decentralized, something which is not usual when you work in a big corporation where a lot of things are hierarchically organized, top down, or in a country or everywhere. So blockchain came with an idea of decentralization, decouple the things, remove the man in the middle, and so on. So basically cut out what you don't really need. And this was kind of a fascinating start. And this was also the idea behind it, to say, how can we use this technology in a pharma industry or in the pharmaceutical industry? And when we then realized, okay, there's potential, we also realized you need to change your thinking, how you organize stuff, how you organize work when you go in a decentralized approach. It's not one dictates, it's everyone is equal. And so we thought that with the blockchain, this idea to bring into in the pharma industry can really help to create a new way how the whole industry is collaborating in the supply chain, in development, in research, everywhere. And I think that is the fascinating thing. And PLA, PharmaLedger Association, is really now the next step to do that. And it's very difficult always to remind the members and saying, hey, we are all equal, the big one and the small one, the patient organization, the big pharma, the research unit, etc. So we are all equal because we want to build the infrastructure where this is possible. And I think that is, for me, which makes PLA special or different to other organizations or units or entities working in that space.
So when we talk about PLA, I think it's good to talk about the benefits it brings. And for me, the biggest benefit is enabling collaboration between its members and different sectors of the healthcare value chain. If you're coming together to create a digitally connected healthcare ecosystem, you need that collaboration. And there's only so much you can do as an individual company, health authority, or patient group. The collaboration across the silos, that's opening up the opportunities which we wouldn't otherwise have access to. One thing's for sure, wherever digital goes, it disrupts. And that has happened in any industry where digital is touched. So working with PLA allows us to learn about these technologies, experiment, and ultimately get value from it.
Yeah, so this is something that's very important to think about in a big picture view. So ePI is just one product. It's the first product and it's a very important product. But at its core, what PharmaLedger is trying to build is an ecosystem. And an ecosystem requires all of those stakeholders to come together and to collaborate on a network or even potentially multiple networks. And the real value of this multi-stakeholder collaboration is that PharmaLedger is in a unique position to be able to bring multiple stakeholders together on an equal footing and really ensure that we are building out what we call this minimum viable ecosystem concept, where we're building products that have all of the required players involved and all the required stakeholders involved, and they're all participating in the network in one manner or another. Some may be bringing, human expertise, some may be bringing technical expertise, some may be bringing organizational expertise. But really what we're building here is a network of stakeholders that collaboratively are able to design and produce a new generation of healthcare software. And really that's the key value proposition for how the PharmaLedger Association works and operates. And it's really what brings our uniqueness to the market. There is no other ecosystem operator out in the healthcare ecosystem like the PharmaLedger Association. And we're really the first to try and take that entire ecosystem approach to developing technology for healthcare.